Hi everyone, I am Akash Ranka. I am a consultant nephrologist and transplant physician. I'm practicing in Thane region since last 7 years or more. I've done DM in nephrology followed by a fellowship in kidney and transplant in Canada. Among chronic kidney diseases that we see in day-to-day practice, almost half of the cases are because of diabetes. Poorly controlled diabetes, then around 10 to 20% are because of uncontrolled hypertension. Then there are specific cases like glomerulonephritis, then there are painkiller related kidney failures also, and then there are genetic diseases. Any cause that can cause kidney issue, if it goes undetected for a while, then being untreated and asymptomatic, not brought into notice, it progresses to kidney failure. Not in all of the cases, but in most of the cases. For example, say diabetes, if diabetes is not controlled and if diabetes related kidney disease is not identified on time and it is not treated on time, it can progress to kidney failure. So all of the listed causes can cause kidney failure, and if these go undetected or untreated, can cause kidney failure. Around 60 to 70% of the cases, they land up directly on dialysis without having any symptoms. But those 30 to 40% fortunate patient may suffer from kidney illness related symptoms like swelling over feet or face, shortness of breath, rise in blood pressure. So if you see young people with high blood pressure, maybe the reason is kidney in many of the cases. Then few people may suffer from blood in urine. Some people may notice some frothy urine or some white discharge in urine. But when it gets advanced, when the need of dialysis comes, that time unfortunately many patients present, and especially with lack of appetite, swelling, and inability to concentrate or sleep, being confused, or sometimes they become sleepy, drowsy. Sometimes they may present with paralysis like related to high potassium level. So in early chronic kidney disease patients, the kind of diet we advise people is to cut down on animal protein, to cut down on salt, sugar, oil, to cut down on weight, to have leafy vegetables, sprouts. Like, I'm not saying Mediterranean diet, but including vegetables, cutting down on non-veg helps. When kidney disease is advanced, that time we have to be more careful about potassium and phosphorus balance. So we have to ask them to cut down on sprouts, leafy vegetables, dry fruits, then any preserved food products, and of course the items which we avoid in early CKD is also not to be given in late CKD patients. But once the patients land up on dialysis, that time their protein requirement is enormous. So we encourage them to have good amount of protein in diet. That means pulses. They can, for non-vegetarian people, they can eat chicken, fish, eggs, no problem. So how can we prevent kidney illnesses? So there is primordial, there is primary, secondary, and tertiary prevention. Most important of it is of course primordial prevention. Patients who are at high risk of having kidney issues in future, like patients who had their parents suffering from kidney failure, they have to be cautious about diet, what they are eating. They have to avoid over-the-counter medications. They have to keep their weight in check, avoid having diabetes, avoid having hypertension. Now coming to primary prevention, those who are already diabetic, hypertensive, those are the people, or those who are obese, they are more likely to have kidney issues. So they have to control sugars, blood pressure, they have to control the weight. And then there is something called a secondary prevention. Those who are already having kidney issues, who are diagnosed, they have to show to the nephrologist appropriately or early, and they have to go for regular follow-up and follow the dietary advice as well, tertiary is often late when patients suffer already from kidney failure. Then they have to be dialyzed on time. People often refuse dialysis and they go for different kinds of alternate therapies, and they keep on suffering more and more. But most importantly, where we can intervene, where we can get maximum benefit, is primary and primordial. As such, life is precious, kidneys are precious, there is no cost that can match it. But if you suffer from kidney failure and if you land up on dialysis, anyways you end up spending between 20 to 40,000 a month. That too when you don't suffer from complications. If you suffer from complications, you will require hospitalization in ICU, and the hospital bills can be enormous, in lakhs. And when you get transplanted, the average estimated cost in private hospitals is around 8 to 10 lakhs minimum, and that too of only transplant. About the medications and their follow-ups, kidney biopsies, and admissions related to any complications related to transplant, it can be really costly. So I recommend everyone to get medically covered as soon as possible to avoid problems in later.
SUD Life, backed by proud legacy of over 100 years with Bank of India, Union Bank of India and Dai-ichi Life Japan.